Myself, Dr. Varsha, and I will demonstrate about the hip bone. So we can say that is a hip bone, that is an irregular bone. It has many synonyms like innominate bone, coxal bone, or hip bone. When we talk about the position of bone, so hip bone is not placed vertical. If we can place it vertical, it will look like this. But it placed obliquely between thigh to waist like this. Yeah, we can see this, that will be placed obliquely, not vertically. Next thing, we will talk about its site determination. The first thing we have to know, that is a acetabulum. That part is called acetabulum, and it will be directly laterally. So it will be directly laterally. If we place it like this, that it will be a bone of left side. Okay, so that will be always in laterally. Next we have flat expanded iliums, that is the ilium part. Flat expanded ilium forms the upper part of bone, ठीक है, and lies above the acetabulum. That ilium part always lie above the acetabulum. Ilium part always lies above the acetabulum, not below. Next thing, that is a obturator foramen. And obturator foramen always be lie below the acetabulum. Next is ischial tuberosity. Ischial tuberosity. Ischial tuberosity will be posterior inferiorly. Then iliac crest, we can see that is a part of iliac crest. That is a iliac crest. Iliac crest should will be on superiorly present. That it will be superiorly. That will be superiorly. And pubis symphysis, that part is called pubis symphysis. It will be antero-inferiorly. That part will be pubis symphysis. That is called symphysial part. Now we can see it's a bone divided into three parts. Ilium, pubis, that part is called pubis, and ischium, that part is a ischium. So now talk about ilium. We know that ilium is a structurally it is a flat, that so that will be called a flat bone. And position of ilium, as we can see, that it will be from above to the acetabulum. Shape of ilium, that will be expanded plate like structure, and it has two ends, upper end, and this is a lower end. That is upper end, that is a lower end. तो now talk about upper end of ilium, जिसको हम ये भी हम बोलते हैं iliac crest. तो it is a broad convex ridge. It can be felt in a living at the lower limit of flank. We can feel it in our groin area. We can feel it in our groin area. And this area, this ilium, separate to the abdominal area to the pelvis area. So below above to the ilium, that part is called abdomen, and below to the ilium, that part will be called pubis. So above to the ilium, that part will be called abdomen, and below to the ilium, that part will be called pubis. Now we will talk about the ilium. So we can see that is a convex ridge, broad, and that will be filled in the lower limit of flank. And curvature की अगर हम बात करते हैं तो curvature कैसा है, vertically convex upward, that is a convex upward anterior posteriorly, and concave inward in front, and concave outward behind. Highest, very important, highest point of iliac crest, that is the highest point of iliac crest अगर हम बात करते हैं सरफेस एनाटॉमी की, तो जो हमें हाईएस्ट पॉइंट ऑफ इलियक क्रिस्ट मिलता है वो मिलता है एट द लेवल ऑफ L3 एंड L4। अब हम बात करते हैं एंड्स, जिसको हम बोलते हैं स्पाइंस। सो इट हैज़ टू स्पाइंस, एंटीरियर in anterior superior iliac spine, that is a anterior superior iliac spine, that is a anterior superior iliac spine, that is a prominent landmark, we can feel it in our body. Next is a posterior, next is a posterior superior iliac spine, that is a very important part in our backside when we lie in a lie down position. We can see a dimple depression, we can see it is a dimple area, that 5 centimeter little to the S2, that part is posterior superior iliac spine. We can see it in a visible way in any patient or in the lie down position. Next, अगर मॉर्फोलॉजिकली बात करते हैं तो क्या इट डिवाइड इनटू टू पार्ट, लॉन्ग वेंट्रल सेगमेंट एंड शॉर्ट डॉर्सल सेगमेंट, दैट इज़ अ लॉन्ग वेंट्रल सेगमेंट एंड दैट इज़ अ शॉर्ट डॉर्सल सेगमेंट। अगर डॉर्सल है तो इट विल बी पोस्टीरियरली, ये वेंट्रल है इट विल बी एंट्रली। Long ventral segment, it forms the more the anterior two-third part crest, that is the iliac crest. इसका टू थर्ड पार्ट जो एंटीरियरली बन रहा है वो किससे बन रहा है, लॉन्ग वेंट्रल सेगमेंट से। और दैट इज़ अ शॉर्ट डॉर्सल सेगमेंट, ये जो है iliac crest का जो है वन थर्ड पार्ट जो बना रहा है वो बन रहा है शॉर्ट डॉर्सल सेगमेंट से। एंड अगर हम बात करते हैं अब borders of ilium की, तो borders, it has three borders, we can see it has three borders. First, anterior border, posterior border and medial border. Anterior border of ilium, that is the anterior border of ilium, start from the anterior superior iliac spine, runs downward to the acetabulum, acetabulum. It has two prominence. We can see it has two prominence. First is the anterior superior iliac spine, second is the lower part, anterior inferior iliac spine. So that is the anterior inferior iliac spine. Next is a posterior border of ilium. Posterior border, we can see that posterior border between the posterior superior, this is a posterior border. Posterior border extend from the posterior superior iliac spine to the upper end of the upper border, posterior part of ischium, that is the posterior part of ischium. It has two prominency. First is the posterior superior iliac spine and second is the posterior inferior iliac spine. When we lower down to the posterior border, it is marked by a large deep notch called greater sciatic notch. Below to the posterior inferior iliac spine, that is a big notch, that is called a greater sciatic notch. That is a greater sciatic notch. We can see it very easily. That is a greater sciatic notch. Now it has three surfaces: gluteal surface, iliac surface and sacropelvic surface. We can see that is a that surface is a iliac surface. We can see that इसको हम iliac fossa भी कहते हैं, दैट्स, और इसको हम iliac surface भी कहते हैं। तो ये क्या है, लार्ज कॉन्केव एरिया ऑन इनर सरफेस ऑफ इलियम, लार्ज कॉन्केव एरिया है। और ये किसके बीच में है, इट इज़ प्रेजेंट बिटवीन द मीडियल बॉर्डर एंड ऑफ द इलियम। मीडियल बॉर्डर एंटीरियर बॉर्डर के बीच में जो है आपका है इलियक सरफेस। नेक्स्ट है ग्लूटियल सरफेस, सो दैट इज़ अ ग्लूटियल सरफेस, वी कैन सी दैट इज़ अ ग्लूटियल सरफेस। दिस इज द आउटर सरफेस ऑफ इलियम, कॉन्वेक्स इन फ्रंट एंड कॉन्केव बिहाइंड, कॉन्वेक्स इन फ्रंट एंड कॉन्केव बिहाइंड। It divided into four area by gluteal line. Shortest anterior gluteal line, longest line inferior gluteal line. So it has a three gluteal line: posterior gluteal line, which is shortest, anterior gluteal line, which is longest, and inferior gluteal line, which is most ill defined. So most longest gluteal line is anterior gluteal line. So shortest gluteal line is posterior gluteal line. So it has three. It divided into four area by three gluteal line. It divided into four area by three uh, gluteal line: posterior gluteal line, uh, anterior gluteal line, and inferior gluteal line. Next surface is a sacropelvic surface, that is a sacropelvic surface of ilium. We can see that is an uneven area on the inner surface of ilium, that is an uneven area on inner surface of ilium. It is situated behind the middle border. So this is a medial border. This is a medial border. We can see this is the medial border, this is the anterior border, and this is the posterior border. So it is behind, it is between the medial border. So this is a sacropelvic surface. It is situated behind the medial border. Now it is subdivided into three parts: iliac tuberosity, auricular, articular surface, or pelvic surface. So iliac tuberosity, we can see that upper large rough area raised in middle part but depressed both above and below. Articular surface, that is a articular surface. And next is a pelvis surface, smooth anterior inferior or auricular articular surface, that is a smooth anterior inferior surface, that is a pelvis surface. So that is a anatomy of ilium.